Hello everyone, I'm Gabriela Sutton, one of the participants at the Young Forum Gastein, and it is a pleasure to be joined by my dear colleague Silvia Ganzerla, who is Policy Manager at EuroHealthNet, the European Partnership for Health Equity and Wellbeing. Silvia was also one of the esteemed speakers in a discussion around the European semester and its implications on health. So EuroHealthNet has done a lot of work around the analysis of the European semester and how it can contribute to key reforms that impact health and well-being. But taking a step back, what is the European semester and what is its relevance to public health?
Yes, Gabriela, thank you for this question, which allows me to explain the semester in a very short nutshell type. So the semester is a European process for governance. The aim is to make sure that at national level, governments are following the same policy priorities and reform that are set out by the European Commission. It is also a tool to make sure that different policies are coordinated. It started with a strong macroeconomic dimension and with the objective of keeping public spending under control, and it has now evolved in having a stronger social inclusion employment dimension. And recently, the semester is also the governance tool to make sure that member states are implementing the pillar of social rights. And the pillar of social rights is the vehicle to tackle socio-economic determinants of health. This is why it's important for health. And we should also mention the SDG, because the semester is also support to monitor the implementation of the SDG at national level. And the SDG are also relevant for health and for tackling socio-economic disparities.
Thank you, Silvia. In your intervention, you also mentioned that it's the right time to talk about how we can integrate health into the European semester process, particularly because of the mandate that is coming within the context of the European Commission. Could you tell us a bit what is planned in the next 5 years under the new EU Commission mandate, and what are the opportunities to strengthen the European semester more towards promoting better health and well-being outcomes?
Yes, this is the right time because we have a new mandate with the European Parliament and the European Commission. At the moment, we know that in the program of Ursula von der Leyen, the semester is still a key governance instrument to make sure that member states and EU Commission policy are aligned. And we are now approaching a time for the revision of the action plan of the Pillar of Social Rights. And in the Pillar of Social Rights, there's a principle on making sure that every citizen has access to healthcare. This is Principle 16. It will be very important for all the stakeholders to make sure that the Principle 16 is captured in the review of the implementation plan of the Pillar of Social Rights, and the semester becomes the tool for monitoring implementation at national level.
And in view of what you said, what would you say are the key calls to action to make sure that the European semester is leveraged as an instrument that can really push for and reorient systems and economies around well-being?
Yeah, again, it's the right time for thinking in this way because the Commission in April passed a review of economic governance, which is going to have an impact on the semester. In a nutshell, basically member states would have the opportunity to plan longer term, up to 7 years, in preparing their program to demonstrate the implementation of EU policy. And this long term is exactly what we need in the health sector to demonstrate that investing in health promotion now will lead to more efficiency, more health equity, and even saving in public budgets. So it's the solution to make sure that policymakers take this long-term approach and ensuring that investments in health is prioritized under the semester.
Thank you so much, Silvia. I think that's a very positive note to end on, and I wish you more fruitful discussions at the Gastein conference.
Thank you very much, Gabriella.